for our midday show. Time to answer your common health questions. And joining me right now is Channel 5's medical expert, Dr. David Soria. He's also the Chief of Emergency Medicine at Wellington Regional Medical Center. First of all, thank you always for coming.
Well, you're welcome, Mike. Good to see you.
Yeah, let's talk about something here called hand, foot, and mouth disease. Now, somebody emailed in and said their friend's baby had to be hospitalized for it. Is that going around our area, and what's being done about it?
Yeah, it's not going around any more than usual, and a lot of thought went into naming that disease, by the way, Mike, hand, foot, mouth. But what it is, it's a viral infection, and it is caused by a virus called Coxsackie A. It's actually very common. Every year we see it quite a bit. Fortunately, it rarely gets serious. Now, it starts off a lot like the flu: cough, sore throat, high fever, aches, but then within 1 to 2 days you start to develop the classic herp angina, which are the ulcers in the mouth, and then you get the rash. And the rash includes red spots on the palms, soles of the feet, and typically it lasts about 3 to 5 days. It usually goes away just as quickly as the flu. Now, treatment, there is none because it's a virus. But what you need to do is make sure your child is well hydrated, because eating and drinking just plain hurts. Those sores in their mouth hurt a lot. They're not going to want to eat or drink, so make sure you push the fluids. How to prevent it? Really, just wash your hands. And when you're done doing that, wash them again. I mean, it's anytime you touch a public surface, wash your hands. That's the best way to do it.
Absolutely. All right, next question for you, doctor. First of all, let's tell people what the croup is and the best way to treat it.
Yeah, croup is also a viral infection, but it's a different virus and it affects a different part of the body. It affects the upper airway, just where the throat, the trachea is, and the larynx. And it affects children, and in children, the upper airway is a little more narrow. So when that inflammation occurs, it can really affect their breathing. That's what causes that classic barky cough.
The really bad cough.
You bet. Now, fortunately, that only lasts a couple days as well. Now, treatment is relatively simple. The inflammation just has to go down. Now, what you do is at home, you can use a humidifier or cool mist aerosol. That'll help soothe their throat and allow that inflammation to decrease. However, if that doesn't work, meaning they're still coughing a lot, having trouble breathing, or you see them sucking in their chest to breathe, much more serious, I want you to bring them into us at the emergency department, because at that point, they need further treatment. Steroids, either injectables or oral, and then, of course, also what we use is an aerosol with epinephrine in it that helps shrink the swelling, allows them to breathe. What doesn't work, folks, don't use cough syrups, over-the-counter, cold preps, and antibiotics don't do a thing. So, hope that helps.
All right, doctor, we're always glad you have your knowledge here. That's why we bring you in for this segment. If you have a question for Dr. Soria, send it in. Go to our website, WPTV.com. Simply click on the health link, scroll down, and on the right-hand side, you'll see a form to write your question. All right, thanks again, Doc.